The state of California says that if a doctor is involved with any more than even just a few hospices, it is a sign of potential fraud. A CBS News investigation into hospices found an industry ripe for fraud, especially in California, where agencies were paid millions in taxpayer dollars for services never rendered, care that's supposed to help people through the end of their lives. At the heart of the industry are doctors who are trusted to sign off on care. But in records for the active physicians caring for terminal patients, one stands out. A man whose name appeared on claims from 126 hospices and had 60% more in Medicare reimbursements than the next closest doctor in 2024, the last full year of available data.
Yeah, my name is Adam Yamaguchi. I'm a correspondent with CBS News, and we're doing a story about hospice.
Dr. Rajiv Bhuva.
We're just trying to understand how often he's here.
I didn't see him long time.
We wanted to find Dr. Bhuva to ask how he managed to work for so many different providers. So we followed a trail of hospice offices linked to him in Medicare claims across the LA basin.
My only comment is not every hospice is like that. There's people who really need the help, and we do provide the help.
Our information tells us that he billed Medicare upwards of $5 million as of the end of September of 2025.
So there's some sort of disconnect between what the records show and what they are telling us.
That disconnect only grew as we followed the federal data trail, which links Bhuva's name to $71 million in federal Medicare claims in 2024. We followed the money to another hospice where Bhuva's name was on bills for 66 patients in 1 month. He was like, that's impossible. We couldn't possibly have that many patients at any given time. And he also told us that Dr. Bhuva no longer works there. On average in California, a hospice doctor cares for about 140 patients in a year. In 2024, claims with Bhuva's name were submitted for nearly 2,800 terminally ill patients. Fewer than 2% of them died, even though most people seek hospice because they are dying. State auditors call that kind of low death rate a sign of possible fraud.
There's no reason to think that that's legitimate.
Dr. Christina Newport has been in the hospice field for 18 years. There are a range of reasons why one physician might be identified in connection with the care of so many patients. One possibility, the doctor's identity was stolen and used to fraudulently bill the government.
Why would it be difficult for a doctor to work at dozens of hospices at any given time?
If someone is really effectively evaluating the plan of care for every patient that they admit to the hospice, which is their job and their responsibility, they would have a superhuman schedule to do that in a meaningful way.
We don't know exactly why Dr. Bhuva's name came up so much. The data trail led us to another hospice nearby.
We understand that Dr. Rajiv Bhuva is the medical director here. We're just trying to get some information about it. He's not?
No.
Was he at some point?
Yes, he was.
But you're telling me he no longer is associated with you guys? No. Was he at some point? CBS News found Bhuva's name tied to several hospices that lost their Medicare certification for what regulators called an abusive billing, a pattern of submitting improper claims. We reached out to him on the phone and email, but couldn't connect with him. With no sign of him at these offices, we headed to Dr. Bhuva's home address. I am parked right outside his house. Hopefully he will answer the door and answer some of my questions, and if not, I came prepared with a letter here. Dr. Bhuva came out, surprisingly spoke to me for about 20 or so minutes. He knew exactly who I was. He is very familiar with our reporting and immediately said, I don't know what else I can tell you. He said that being affiliated with dozens of hospices is not illegal. And I said, you're correct. There's nothing in the law that prevents someone from being affiliated with many. But again, it raises flags, and that's what I have questions about. Bhuva said he wanted to see our information. Until then, he wouldn't talk any further. I'm back at Dr. Bhuva's house, right here. We returned with our data. Hi, Dr. Bhuva. This is Adam Yamaguchi again with CBS News. We were able to hear you through the door. Just want to give you every opportunity to speak with us before we publish. I've got a list here. Give him every opportunity. Rang 3 times, knocked once, talked through the wall, or the door rather. Came with what he asked for. He's made his decision not to talk.